Coming to the place that you're ready to consider hospice care for your loved one, that's a heavy decision. Please understand that choosing hospice is an act of advocacy for your loved one, for their dignity, for their peace, for the best life they can have at this point. The core message from hospice is never a message of giving up. It's a shift in focus from curing the illness to caring for the person and each day that they have. The goal is to ensure the loved one lives as fully and as comfortably as possible for whatever time they have left. When should you actually start considering hospice? Well, generally hospice in medical terms is for those that have a life expectancy of 6 months or less if the disease follows its natural course. Now, you and I both know that nobody can say exactly when. I've worked in hospice for many years. I've known people that have been on hospice for many years. And I've known of people who came off of hospice. When your medical professional has determined that if the disease progresses at its expected rate, life expectancy is under 6 months. There are signs you can look for. Frequent hospitalizations, repeated trips to the ER, a significant decline in daily activities, their appetite, eating, walking, dressing. When the treatments seem to be causing more of a burden than a benefit to them. I'll be honest, after my years in hospice, most families wish they had started hospice much sooner than they did. They always said, I wish I wouldn't have waited so long to get this kind of care for my loved one. And understand, hospice can be revoked. You're not locked into anything. If at any time the patient stabilizes or wishes to seek curative medical treatment again, that's not a problem. They can revoke hospice. So, who is the hospice team? Who is it that actually enters the life of your loved one? Well, it is called an interdisciplinary team. There are people from many different disciplines who provide the care and the support that your loved one needs and that you as a family member will find invaluable. You will have nurses and aides who will help manage pain and symptoms and provide personal hygiene for your loved one. There are social workers who will assist with emotional support and logistical planning of different things. They also provide chaplains or spiritual counselors who provide non-denominational, faith-based support for your loved one and also for the family. You're going to have volunteers who offer companionship or who can give you a breather so that you can go get your shopping done or go to your own doctor's appointment or whatever the need may be. They also provide bereavement counselors even up to 13 months after the loss of your loved one to help you walk through those tough days. The beautiful thing is hospice happens wherever home is for your loved one. Over 90% of hospice care is provided in private residences, assisted living, maybe even nursing homes. For short periods, if symptoms cannot be managed at home, care may move to a dedicated hospice facility or even a hospital. You also have access to what they call respite care. This is a really vital benefit where the patient can stay in a nursing facility for up to 5 days just to give you or the caregivers a necessary rest or maybe a trip you're needing to make. Financially, how is it covered? Well, there's 100% coverage for those with Medicare Part A. Hospice is typically covered at no cost to the family, and this will include medications for pain, for symptom management, medical equipment, hospital beds, oxygen, wheelchairs, medical supplies, bandages, products that they may need. In conclusion, hospice brings the expert to you so that you can go back to being the daughter or son or spouse instead of the medical caregiver. So call a local hospice provider. They'll give you a no obligation evaluation. They'll visit your home and explain to you how they can help you and your family member. You're not alone. Thank you.